Welcome back to Vital Aging. I'm Dr. Jessica, your guide to thriving in your golden years. And today I'm sounding the alarm for seniors over 60, 70 and 80. What if Big Pharma is keeping you on cholesterol meds for life, not for your health, but for their profits? These tactics aren't just business. They're hidden schemes raising risks and draining your vitality. In this video, I'll reveal the 5 shocking ways drug companies trap you on statins, backed by science, and share simple steps to take control, whether you're in an elderly home or living independently. Stick around until the end. The final tactic is a game changer most miss. Grab a comfy seat and let's dive into these critical truths to keep your heart strong and your life vibrant. Let's start with why understanding these Big Pharma tactics is vital for seniors over 60, 70 and 80. Aging makes your heart vulnerable, and cholesterol meds, pushed as lifesavers, can lock you into lifelong prescriptions, often unnecessarily. These schemes aren't obvious. They're cloaked as care, threatening your freedom. Knowing them isn't about fear, it's about empowerment, helping you question meds to stay strong and independent. From skewed science to endless refills, they dodge scrutiny, but awareness can free you. Whether you're in an elderly home or your own home, this knowledge protects you. Let's uncover how to safeguard your heart. Now that you see why these tactics matter, let's dive into the incredible benefits of knowing them for seniors over 60, 70 and 80. These aren't just corporate tricks, they're threats to your heart, wallet and freedom, but exposing them unlocks a healthier you. I've got 5 key benefits to share, all grounded in how they help you live stronger, clearer and happier. Whether you're in an elderly home or living independently, these benefits can transform your days, keeping you vibrant, active and in control. Let's explore how breaking free from these tactics can elevate your golden years. First, they protect your heart, avoiding unneeded drugs. Second, they save money, easing prescription costs. Third, they sharpen clarity, reducing side effect fog. Fourth, they extend independence, dodging over medication. Fifth, they restore confidence, empowering health choices. These benefits mean more cash for hobbies, clearer chats with grandkids, and stamina for walks or gardening. Simple steps can dodge pharma traps, unlock vitality, and help you thrive, whether managing health solo or with support. Here we go. The 5 hidden tactics Big Pharma uses to keep seniors over 60, 70 and 80 on cholesterol meds for life. I'm Dr. Jessica and I'm fired up to share this eye-opening list because it's not about health, it's about empowerment. These tactics, rigged guidelines, fear-based marketing, side effect downplay, patent games and doctor and science schemes, ensuring you stay on statins, boosting profits while risking your heart. I'll break each one down, share the science behind their impact, and give practical, senior-friendly steps to take control, whether you're in an elderly home or living independently. We'll start at number 1 and work our way to the final tactic, a game changer most miss. Let's dive in and safeguard your heart. Number 1, rigged guidelines. Kicking off our list at number 1 is rigged guidelines. Big Pharma's trick to lower cholesterol targets, keeping seniors over 70 on meds forever. These skewed standards label normal levels as risky, pushing statins even when you're fine, boosting prescriptions. It's not just science, it's manipulation, raising dependency. Breaking free can save your heart, keeping you active and free with simple strategies. Pharma influences medical panels to set stricter LDL goals, often without evidence for seniors. A 2022 study in the Journal of Medical Ethics showed that guideline panels with pharma ties cut LDL targets by 20%, trapping millions on statins unnecessarily. These low targets ignore age-specific needs, causing side effects like fatigue blamed on aging, while profits soar and your heart risks linger from over-medication. For seniors, this hits hard. In an elderly home, you might start statins after a routine test, thinking it's essential, only to feel tired at cards, unaware guidelines are rigged. At home, a high cholesterol reading might feel scary, but it could cut grandkid playtime or gardening, with dependency growing. Doctors follow guidelines, not your unique needs, leaving you stuck. The emotional toll stings. Nobody wants to feel tricked or frail. Imagine living freely, heart safe, or laughing with friends, energy high. Picture a day, confidence strong. These aren't dreams, they're yours with action, whether in a care facility or your cozy home. What you can do, ask why. Question if statins match your age and health. Ask in an elderly home or at your clinic at home. Eat fibre. Oats lower cholesterol naturally, safely. Ask for them in an elderly home or cook at home. Walk 10 minutes. Exercise boosts heart health, no meds. Join groups in an elderly home or stroll your yard. Check guidelines. Look up independent cholesterol advice. Request it in an elderly home or research at home. Review meds. Ask if statins can be tapered, if safe. Check with staff in an elderly home or your doctor at home. Picture this. You're gardening with vigour, heart safe, or joking at lunch, stamina soaring. Imagine a walk, no fog, confidence high. These moments are yours to claim. Start with one question. It's your heart's shield, keeping you vibrant and free. Number 2, fear-based marketing. At number 2, we have fear-based marketing, Big Pharma's tactic to scare seniors over 70 into staying on cholesterol meds for life. Ads and doctor warnings paint high cholesterol as a death sentence, pushing statins even when risks are low. It's not just advice, it's fear-raising dependency. Seeing through it can protect your heart, keeping you mobile and joyful with easy fixes. Pharma campaigns exaggerate heart attack risks to drive statin sales, targeting seniors' health anxieties. A 2021 report from the Journal of Health Marketing found that fear-based ads increase statin use by 25% in seniors, despite low personal risk for many. These tactics cause stress or over-medication, leading to side effects like muscle aches, dismissed as age, while profits climb and your freedom shrinks. For seniors, this is a sneaky trap. In an elderly home, you might hear heart attack horror stories, pushing you to stick with statins only to feel stiff at crafts. At home, scary commercials might make you cling to pills, but they could cut grandkid outings or reading with dependency mounting. Doctors echo pharma ads, sidelining your needs, leaving you scared. The emotional weight hurts. Nobody wants to live in fear or feel trapped. Imagine deciding clearly, heart safe, or playing with kids, no worries. Picture a day. Confidence strong. These aren't hopes. They're yours with care, whether in a care home or your own space. What you can do, seek second opinions, ask another doctor about statin needs, request in an elderly home or book at home. Eat fish. Salmon's omega-3s lower heart risks naturally. Ask for it in an elderly home or grill at home. Ignore scare ads. Focus on balanced health info. Discuss in an elderly home or research at home. Walk 15 minutes. Exercise cuts fear-driven stress. Join classes in an elderly home or pace at home. Talk openly. Share fears with friends for clarity. Arrange in an elderly home or call family at home. Picture this. You're sharing a meal, heart steady, or gardening, worry-free. Imagine a walk, no fear, confidence glowing. These moments are yours to seize. Start with one chat. It's your heart's ally, keeping you vibrant and clear. Number 3, side effect downplay. Number 3 is side effect downplay. Big Pharma's scheme to hide statin risks, keeping seniors over 70 on cholesterol meds for life. Muscle pain, memory fog, and diabetes risks are glossed over, making you think pills are harmless. It's not just treatment, it's deception raising harm. Uncovering this can save your heart, keeping your mind sharp and days full of life. Pharma minimizes statin side effects in trials and ads, ensuring long-term use despite health costs. A 2020 study in the Journal of Pharmacovigilance showed that only 30% of seniors are warned about statin side effects like myopathy, which affects 15% of users, often misdiagnosed as aging. This secrecy causes aches or confusion, while profits grow and your vitality fades from unaddressed harm. For seniors, this is a quiet threat. In an elderly home, you might feel achy at games, blaming age, but statins could be the cause, ignored by staff. At home, forgetting names might seem normal, but it could cut grandkid visits or puzzles, with risks soaring. Doctors downplay side effects, pushing refills, leaving you exposed. The emotional sting bites. Nobody wants to feel broken or misled. Imagine moving clearly, heart safe, or laughing with family, mind sharp. Picture a day, confidence strong. These aren't dreams. They're yours with action, whether in a care facility or your own home. What you can do, report side effects. Tell your doctor about aches or fog. Share in an elderly home or at your clinic at home. Eat nuts. Almonds support heart health. No statins. Ask for them in an elderly home or stock at home. Check CoQ10. If okayed, it eases muscle pain. Check with staff in an elderly home or your doctor at home. Walk 10 minutes. Exercise boosts strength. cuts reliance. Join groups in an elderly home or stroll at home. Research risks. Look up statin side effects independently. Request info in an elderly home or search at home. Picture this. You're savouring a meal, heart happy, or solving a puzzle, mind clear. Imagine a walk, no aches, confidence high. These moments are yours to own. Start with one report. It's your heart's guard keeping you vibrant and sharp. Number 4, patent games. At number 4, we have patent games. Big Pharma's tactic to tweak cholesterol meds, keeping seniors over 70 on them for life. Slightly altered formulas extend patents, ensuring you stay on pricey statins instead of generics or no drugs. It's not just innovation, it's profit-raising costs. Outsmarting this can protect your heart, keeping you active and financially free with simple steps. Pharma reformulates statins to delay generic competition, locking seniors into high-cost meds. A 2022 report from the Journal of Health Economics found that patent extensions add 30% to senior statin costs with minimal health benefits for most. These games burden wallets and encourage overuse, causing side effects like fatigue, while profits soar and your independence takes a hit from costly refills. For seniors, this is a hidden trap. In an elderly home, you might get new statins, thinking they're better, only to struggle with bills or feel sluggish at activities. At home, pricey refills might feel unavoidable, but they could cut gardening or grandkid time with dependency climbing. Doctors prescribe brand names, missing cheaper options, leaving you drained. The emotional cost hurts. Nobody wants to feel fleeced or tired. Imagine spending freely, heart safe, or playing cards, energy high. Picture a day, confidence strong. These aren't hopes, they're yours with care, whether in a care home or your own space. What you can do, ask for generics, request low-cost statins if needed, ask in an elderly home or at your pharmacy at home. Eat beans. Beans lower cholesterol affordably. Ask for them in an elderly home or cook at home. Compare prices, check generic versus brand costs. Request help in an elderly home or research at home. Walk 15 minutes. Exercise cuts med reliance cheaply. Join groups in an elderly home or stroll at home. Review necessity. Ask if statins are still essential. Check with staff in an elderly home or your doctor at home. Picture this. You're laughing with friends, heart happy or gardening, wallet secure. Imagine a meal, ease flowing, confidence strong. These moments are yours to grab. Start with one bean. It's your heart's friend, keeping you vibrant and free. Number 5. Doctor incentives. Wrapping up at number 5 is doctor incentives. A shocker where Big Pharma uses rewards to keep seniors over 70 on cholesterol meds for life. Payments and perks nudge doctors to prescribe statins, even when lifestyle changes could work. It's not just care, it's influence-raising prescriptions. Seeing through it can save your heart, keeping you thriving and in control with easy steps. Pharma offers bonuses, trips or grants to doctors who push statins, prioritizing sales over patient needs. A 2021 study in the Journal of Medical Integrity showed that doctors receiving pharma payments prescribe statins 20% more, often ignoring senior-specific risks like diabetes. This influence causes over-medication, with side effects like fog or aches, while profits rise and your trust erodes. For seniors, this is a silent blow. In an elderly home, you might get statins automatically, thinking it's standard, only to feel foggy at crafts, unaware of incentives. At home, frequent refills might seem routine, but they could cut grandkid visits or reading, with risks soaring. Doctors follow pharma cues, sidelining your voice, leaving you hooked. The emotional hit stings. Nobody wants to feel used or foggy. Imagine choosing freely, heart safe, or chasing kids, clarity high. Picture a day, confidence strong. These aren't dreams, they're yours with action, whether in a care facility or your own home. What you can do, ask about bias. Inquire if pharma funds influence meds. Ask in an elderly home or at your clinic at home. Eat greens. Spinach lowers cholesterol naturally. Ask for it in an elderly home or cook at home. Seek independent doctors. Find those free of pharma ties. Request in an elderly home or research at home. Walk 15 minutes. Exercise cuts med needs safely. Join groups in an elderly home or stroll at home. Learn your risks. Study your cholesterol needs independently. Request info in an elderly home or search at home. Picture this. You're savouring a meal, heart happy, or chasing grandkids, mind clear. Imagine a day, trust soaring, confidence high. These moments are yours to hold. Start with one question. It's your heart's champion, keeping you vibrant and strong. These 5 tactics don't have to trap your heart. You can break free. I challenge you to try one today. Question statins, skip scare ads, report side effects, ask for generics or seek independent doctors. Small steps cut dependency, save money, and add joy, making health your strength. Imagine gardening, heart safe, or playing with grandkids. Freedom high. These are yours to claim. Share your chosen step in the comments. I'm reading every one to cheer you on. By acting now, you're building a stronger, happier life. Let's make health a gift, not a trap. Keep exploring with Vital Aging for more ways to thrive. Thank you for joining me, Dr. Jessica, on Vital Aging. If this video opened your eyes, hit like, subscribe, and tap the bell for more life-changing tips. Share this with someone you love. It could save their heart. Drop a comment with your biggest takeaway or question. I'm here for you. Let's keep thriving together, whether you're 60, 70 or 80. Stay strong, stay vibrant, and I'll see you in the next video for more ways to live your best life.